Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Global review links common viral infection to higher heart attack and stroke risk. Scientists have confirmed that several common viral infections significantly increase the risk of cardiovascular disease, including coronary heart disease and stroke. A comprehensive systematic review and meta-analysis published in the Journal of American Heart Association synthesized data from 155 studies, demonstrating that viruses such as influenza, COVID-19, HIV, hepatitis C, and shingles are linked to both short and long-term elevated cardiovascular risk. Cardiovascular diseases remain the leading cause of death globally, traditionally attributed to factors like high blood pressure, smoking, and poor diet. However, this study highlights viral infections as important, often overlooked triggers which induce systemic inflammation, causing endothelial damage and increased blood clotting. These mechanisms can rupture atherosclerotic plaques, precipitating heart attacks and strokes. Researchers conducted extensive literature searches across 5 scientific databases, including Medline and Web of Science, identifying over 52,000 records published up to July 2024. Screenings and quality assessment resulted in 155 relevant studies, which comprised cohort, case control, and self-control case series designs. Data were pooled to calculate long-term risk ratio and accurate incident rate ratio for cardiovascular outcome following viral infections, adjusting for demographic and lifestyle confounders. Laboratory confirmed influenza raised acute myocardial infarction risk 4-fold and stroke risk 5-fold within the first month of infection, peaking in the first week. COVID-19 was associated with a 74% higher long-term risk of coronary heart disease and 69% increased stroke risk. SCCS studies showed a 3.35-fold elevated risk of heart attack within 14 weeks. Chronic infection like HIV carried a 60% higher coronary heart disease risk and 89% decreased heart failure risk. Hepatitis C and shingles also contributed to elevated cardiovascular complication, with stroke risk spiking shortly after shingles infection. Some viruses required further study due to limited evidence, while cytomegalovirus association remained inconclusive. Lead author Dr. Kosuke Kawai emphasized vaccination as a crucial preventative measure, noting influenza vaccine can reduce cardiovascular risk by 1/3. Now, this work urges integration infection prevention into cardiovascular health strategies worldwide. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.